My name is Alejandra Alonso. This is my head to toe assessment video. My volunteer is Lily. She's a 26-year-old Hispanic female. Hi Lily. We're going to begin by taking your vital signs. Okay. You're just going to take your blood pressure. You doing okay?
Yeah. Good.
Start here. This the pulse ox is gonna check your oxygen level. Okay. Temperature 98.3. And your oxygen is 97% good. Some room air. Your heart rate is 76. And your blood pressure is still ticking. I'm gonna go ahead and remove this one since we're checking that. So, what brought you in today?
I have a lower back pain
Okay, when did you notice that pain started?
since I started working at the nursing home
At the nursing home? Okay, and about how long ago you started working at the nursing home?
about like a year ago.
Okay. Alright, your blood pressure is good. It's 128 over 56. Okay. So about a year ago you started working as a CNA at the nursing home?
Yes.
And then that's when you noticed your back started hurting?
Yeah, I was transferring a resident,
Okay.
and it's when I.
When it started hurting?
Yes.
Okay, can you please step here and we're gonna get you weight real quick. And about how tall are you?
4'11".
4'11". Okay. And then your weight is 129. Okay. Alright. Have you noticed any recent loss weight or
No.
no, not more than 10 pounds gain either?
No.
Or less? Okay. Alright. Do you take anything for the pain?
I take Tylenol and Advil.
Alright. And about how much of the Advil you take?
For 450.
450 or 400 milligrams?
Yes, 400 milligrams.
400 milligrams, okay. And then the Tylenol, you do the 350 milligrams?
Yes.
Okay. It's not the extra strength?
No.
Extra strength, okay. And do
And I
you...
take 2 times
2,000.
Tylenol. And I take Tylenol PM to sleep.
Okay. Do you do the Tylenol PM because you have trouble sleeping because of the pain?
Yes.
Okay. Alright. Okay. Do you have any past medical history?
No.
Any surgeries?
No.
Okay. Any allergies to food or medications?
No.
Okay. Any emotional problems, depression? Have you been crying lately? Any problems like that?
No.
Okay. Are you single, married?
I'm single.
Single. Any kids?
No.
Okay. Alright. When was the last time you had your menstrual period?
This month.
This month, okay. And do you take any birth control?
No. Just I use condoms.
That's okay. Good. Have you been tested for STDs before?
No.
No? Okay. Well, maybe that's something you want to look into, okay?
Okay.
Maybe after get it tested, just, precaution. Let me see. How about your family? Any history from your family?
My mom has high blood pressure.
Mm-hmm.
My dad has cancer and diabetes.
Mm-hmm.
And my sister has thyroid problems.
Okay. Okay. All right. So when was the last time you had a bowel movement?
This morning.
Okay. No diarrhea, constipation?
No.
Any fever, nausea, vomiting?
Uh-uh.
Okay. How about when you urinate? Does it hurt, burn, itch?
No.
No. Okay. Okay, and then on your medications, just to verify them, you take Tylenol and Advil, and then you take those just every time you feel pain?
Yeah.
Okay. When was the last time you took them? Today?
At 6.
Okay, 6, okay. You took just the Advil or both of them, the Tylenol and the Advil?
Just the Advil.
Advil, okay. And you took the Tylenol PM last night?
Yes.
Just 1 tab?
Yeah.
And then the Advil, you do the 2 tabs? And
Yes.
same with the Tylenol, okay. Any other medications?
No.
Okay, and your vaccines are up to date?
Yes.
Have you had the flu shot?
Yes.
Okay. When was that?
November 3rd.
Okay. Alright. I think we're good on just some of those questions. I'm gonna go ahead and begin with this assessment, okay? I'm just gonna start by just looking at your skin. Do you have any bruising?
No.
Okay. Alright. Just gonna look at your arms. Okay. Any skin tears or wounds I should know about?
No.
Okay. Good. You're warm, dry, and you have a good temperature. Okay, I'm gonna go touch your hair, okay? Just gonna touch it. I like your haircut.
Thank you.
Okay, tell me if you feel any pain, okay? I'm just palpating to see if any abnormal things are going on in your head.
Okay.
And you don't have any headaches, dizziness?
No.
Okay. Your hair is short, and see you colored here at the end of the hair. It's a little bit just dry at the ends, but everything else feels pretty moist. I wish my hair was like that. Okay. And okay, so your hair is good. I'm just gonna chart that real quick. We have this good distribution. So we're good on that part. Okay, I'm gonna look at your nails just real quick. Okay, let me know if you feel any pain when I touch them. And then they're short, clean. No pain?
No.
You okay?
Yeah.
Okay, I'm just gonna I'm gonna go ahead and do this, okay? So let me know if it hurts. Like, wanna turn your hand like that? Alright. Alright. Does it hurt when I
No.
put it on like that? Not like that. No. Okay. Good. Alright. So your nails look good. Here we're gonna do. I'm gonna do the Tinel sign. Here we're gonna check for carpal tunnel syndrome. What I'm gonna do, I'm gonna tap with my 2 fingers directly over the transverse carpal ligament in the proximal hand, right here, and also in the distal wrist, right here. So I'm gonna show that from a different angle. I'm gonna do right in the across the transverse ligament. Yeah. So, and then in the distal. If the patient complains of any pain or numbness, most likely if it's a positive for the carpal tunnel, the patient will complain of numbness and paresthesia along the fingers. Okay, here I'm gonna continue to check for carpal tunnel syndrome. So now I'm gonna do the thumb abduction test, which is gonna isolate the strength of the brevis muscle. Here I'm gonna ask Lily to place the hand with her palm up and raise the thumb perpendicular to it. Okay. And now I'm gonna go ahead and apply pressure. She's gonna go against it. We're gonna do a different position. I'm gonna put her hand like this now. Again, her thumb up in apply position. Here I'm meeting resistance, which is an expected outcome. If she showed any weakness, then I will refer her for carpal tunnel syndrome. So here we're doing good.
No carpal tunnel?
Now we're gonna begin to check the range of motion of the hand and wrist. I'm gonna have Lily um, flexion and hypertension her wrist. So we're gonna check the metacarpophalangeal flexion and the hyperextension. She's gonna go ahead and flexion her hand 90 degrees. So go ahead, flexion. Right here we're checking. She can do it. Are you having any pain? No? Good. Now we're gonna go ahead and hyperextension 30 degrees. And she is doing good. Okay. Now we're gonna check her finger flexion, and she's gonna go ahead and do her thumb to each fingertip to the base of the little finger. So she's gonna do each one. There we go. Okay. Now we're gonna do the third test, which is the finger flexion. We're gonna check here her to do a fist. Good. We're gonna do the next movement, which is the finger abduction. And on here, she's just gonna open up and spread her, there we go, her hand. Okay, and now we're doing the wrist flexion and hyperextension. I'm gonna have her extend 70 degrees, and now she's flexioning 90 degrees. So we're gonna do that again. 70 degrees and flexion 90 degrees. So right there we just checked her wrist flexion and hyperextension. Now lastly we're gonna do the wrist, radial, and ulnar movements. So here we're checking right here, and we're gonna check the ulnar by moving it 55 degrees. There we go. She's doing that. Going back to original position. Now we're gonna check the radial by moving it 20 degrees. There we go. And do that. And that's how you check the range of motion of the hand and wrist. Alright, now I'm gonna go ahead and check your ears. I'm just gonna go get my, okay, so I'm just gonna get this thing ready so I can check your eyes. Okay, turn it on, show that the eye is working. I'm gonna have you look at this shoulder, okay? So okay, and then down. Okay, your sclera is clear, no drainage, no inflammation. Your eyelashes look good. They're long and straight. Does the light bother you at all?
No.
Okay. All right. Now we're gonna look at here. Okay.
Okay.
Okay. So. Okay. No drainage, no inflammation, no redness. Your eyelashes are good. Have good distribution, and they're reactive to the light. Here we're gonna do a closer look of the eye. We're gonna inspect the eyelash and the eyebrow, which the eyebrow has a good texture, good distribution. The eyelashes are long and straight up. There's no edema, no sagginess, no tissues, no puffiness or lesions visible. We're gonna look around and pull down and see. It's pink and moist, no visible lesions. The sclera is white. We can see some blood vessels. The lacrimal sac, it's normal. Now we're gonna check if she can completely close and open her eyes. So go ahead and close your eye, and now open it. Good. so she can complete